Hello, everyone. My name is Camellia. I am a psychiatric mental health nurse practitioner, also known as a PMHNP. I'm also a nursing and mental health enthusiast. And I wanted to actually get on today to share some more information. If you guys have been following me, there is a video that I did a little bit ago back in October on my leaving private practice. And in that video, I mentioned that I was an independent contractor. And so today, after talking with someone a little bit more specifically there, I actually wanted to share some more information around what that means and really give you guys a little bit more of a high level overview of the difference between being an independent contractor and a W-2 employee. The first thing to know is that you can be either a 1099 contractor, also known as an independent contractor, or a W-2 employee in any setting as a PMHNP. You're going to find different variations of that. It's more common at the corporate higher level organizations to actually be on their payroll as a W-2 employee. It's more common in private practice and some of the telepsych positions for you to be a contractor or a 1099 contractor. But you can really be in any of those based on what the job requires. So you will actually see this information listed in most cases on a job description. So if you see W-2 employee versus a 1099 contractor, you may have some information, some insight as to what that means. Okay. As you guys remember, I was an independent contractor. I'm also an independent contractor for telepsych. I was the same in private practice. But what's important about that is that as a 1099 contractor, you are likely going to see that the rates are higher, but you are going to be based on a contractual agreement over a set amount of time. And most of those agreements will spell out if you're paid per visit or per patient, and or if you're paid per hour. And so what's important about that is that your rates are going to be higher in most cases, but I want you guys to keep in mind that those rates are higher without any deductions. So as a 1099 contractor, you do not have any of your taxes, federal, state, or self-employment taxes deducted from your pay. So one of the drawbacks in being a 1099 contractor is that you are responsible for keeping up with that and to be sure that those things get paid. The percentages of those things vary based on your state, of course. But I do have people to do a calculation, for a W-2 position versus a 1099 position. If you notice that you're paid higher, the rate's higher, do kind of do a calculation after you've done the percentages of your state, federal, and self-employment tax to see if it matches up with what a W-2 job would be listed as. So that's important because a lot of times those higher rates are not really higher rates when you put this into perspective. What's also important about, in addition to having to deduct your own taxes and pay those independently, is that in most of these positions, unless it's spelled out in your contract, you are actually not going to be paid for patients that don't show up. So keep in mind that can actually be a little more inconsistent in terms of your livelihood. If you are working just a 1099 position, some contracts actually allow you to be paid, but at a lesser rate. But do keep that in mind, and that is something that you would want to ask ahead of time. If you are applying for a 1099 position, is this based on patient volume? Am I getting paid based on an hourly rate? And do I get paid for no-shows? If so, what is the percentage that I'm paid for patients that don't show up? So that's one of the drawbacks, is that it can be a little more inconsistent in terms of your volume and your pay. What's also important about a W-2 employee is that you are usually paid based on an hourly rate or salaried rate. Most of these positions are salaried, where you have an annual base pay. Many of these positions also include benefits. And that's one thing I did not say about a 1099. Most of those positions do not, they don't offer any benefits. So you will also be responsible for that. So keep in mind that when you're doing sort of this comparison, how much is it going to be for you to apply for your own health benefits and those other types of things. So for a W-2 employee, just keep in mind that this is sort of a packaged deal where you're already set the amount that you're going to be paid, whether that's hourly or if you're a salaried person, your base pay annually. You are usually well aware of what your benefits are. Your taxes are already deducted. You do not have to pay self-employment tax as a W-2 employee. And then the other real big thing with a W-2 employee is that you are paid usually regardless of any no-show visits. So that's important for you guys to know, because if you are looking for a position in psychiatry or as a nurse practitioner, you will be able to decipher and kind of get an idea of what it could offer you, but what some of the drawbacks are. And then really based on kind of what you have going on life-wise, is it going to be worth it for you to pursue one versus the other? And again, you're going to see it in various settings, but I did want to sort of share that information here with you guys today. If you guys have found any ways that have been anything else that you have found helpful in this arena of W-2 versus a 1099 contractor, please comment, message below, let me know, and I'm happy to hear your feedback, comments, and/or questions. Thank you.